Thank you, Hanan, and it's lovely to see everyone here tonight. So I'm going to update you on my most recent trip. I came out of Gaza last week, and I'm going to start by quoting the CNN quote of the day from a few weeks ago. I didn't know CNN gives a quote of the day, but it was given by a good friend of mine, Thea Ahmed, who's an ER physician in Chicago, and I spent some time with him in the States recently doing advocacy work for Gaza. And he was asked what it was like in Gaza, and they put this as their quote of the day, and I'll quote him. It was apocalyptic, it was horrific, it was miserable. And as much as I love Gaza and will keep on going back there, the situation there is indeed apocalyptic, horrific, and miserable. I'm going to illustrate this with talking about 4 individuals that I met when I was there over the last 2 to 3 weeks. 2 of them patients, and 2 of them healthcare workers. And I'm going to start by describing what the 2 healthcare workers spoke to me about. First one was Haytham, who's a young doctor I'd met previously. I didn't recognize him this time because he's lost about 25 kilos in weight. He had been abducted and kept as a prisoner by the Israeli Defense Force for 60 days. And he told me in great detail, and I've got a very detailed audio testimony of what he went through and the daily torture he underwent whilst imprisoned by the IDF. But he started talking about the drones, and we all know what drones are, and indeed when you're in Gaza you hear drones non-stop 24 hours a day. But he talked about the quadcopters, and many of you may know what the quadcopters are. They're drones, they're automatically controlled, and they have guns on them, and they go into hospitals and they target healthcare doctors and nurses and shoot them by remote control. They've got quadcopters which not only have guns on them, but they have recording voices on there, so they shout out, they mimic babies crying, they mimic small children calling out for help. So people come out of their houses thinking they're going to find a baby in distress or a toddler looking for help, and then they're shot by the quadcopter who has dragged them out. That's what they have to contend with. So Haytham was taken by the IDF at a checkpoint when he was leaving Nasser Medical Complex and taken to a large field with many other healthcare workers, stripped naked, handcuffed and blindfolded. He was handcuffed with his hands behind his back. He was blindfolded, and he remained like that for 61 days. He did not see any light for 61 days. His hands were handcuffed behind his back. They interrogated him for the first few days, and during those few days he was beaten non-stop for 12 hours at a time, with sticks, with guns, with kicks, with punches. He thought if he said he was a doctor that they might be lenient, but in fact he said it made it much worse. They kept saying to him, and I'm quoting him, "You're a doctor, beat, thump, hit. You're a doctor, hit, thump, beat up," repeatedly for 12 hours. He wasn't allowed to lie down for 61 days. None of the prisoners there were allowed to lie down. They were forced either to stay on their knees or to sit. If anyone fell asleep and lay down, every single prisoner there was punished by being placed on their knees and being beaten if they moved for 12 hours. For the first 3 days he had no food and no water. They tightened his handcuffs so his hands became numb and swollen. Several people he knew there developed gangrene of their hands and had to have their hands amputated. They didn't see what was going on because they were blindfolded, but they had dogs running around them barking. They were convinced they were going to be attacked by these dogs. Sari is a young nurse who I met and indeed worked with most days in the operating theatres at Al-Aqsa Hospital. He was abducted in December from the Indonesian hospital and had very similar experiences. They not only had quadcopters when he was taken, they had dogs attacking them. The dogs had cameras on them, recording them, and the dogs also had guns attached to those cameras in the form of quadcopters. And the dogs went round, and using remote control, the guns were used to kill healthcare workers and patients and refugees in the hospital complex. I repeat, this is all written and audio testimony which will be used in the International Criminal Court. He was repeatedly beaten, as Haytham was, particularly with guns to the head. They were repeatedly accused of being Hamas sympathizers, and he was often beaten for 12, 16, 18 hours a day. His hands were handcuffed behind his back. He now has recurrent bilateral dislocation of his shoulders. He showed it to me. I've got it on video of him dislocating his shoulders because of the position his hands were held in. There are many, many stories like that, and what is incontrovertible is those evidences, those testimonies will be used to prosecute Netanyahu and his government for crimes against humanity. I'm going to tell you about two more individuals who were patients of mine, both of whom died. Tala was a 16-year-old girl who arrived in Al-Aqsa Hospital cachectic already because she was so malnourished, and she'd suffered a blast injury from a bomb and had a single injury to her small bowel, which was very easily repaired. She developed multiple complications related to infection because she was so malnourished, and she died in front of us. I'll tell you about Lama, who was 18 years of age. She had a blast injury. She was malnourished. We operated on her about 12 times. She had more extensive injuries. 12 times we operated on her. 12 times she put up with this, and on the day we left, she died. Both of those individuals, a 16-year-old girl and an 18-year-old girl, died predominantly of malnutrition. They had injuries that they would have survived. Malnutrition is the biggest problem facing the population of Gaza now. We know that the IPC has designated northern Gaza as a famine now. Middle Gaza is going that way, and now we know what's happening with Rafah. That will rapidly follow. This is a man-made famine. This is starvation being used as a weapon of war. So we now have incontrovertible evidence, which I again assure you will be used to prosecute those criminals, that healthcare facilities are being directly targeted, healthcare workers are being directly targeted, they're being killed, they're being executed, they're being abducted, and they're being tortured. The healthcare system has been almost completely disabled now. There are no properly functioning hospitals, and I would estimate I could count on one hand the number of partially functioning hospitals. Malnutrition is going to lead to many, many excess deaths. We became familiar with that term, didn't we, during COVID? That number of 35,000 people died as a direct result of trauma, that almost certainly anyway is a gross underestimate, but that figure will be dwarfed by the excess deaths we will see from malnutrition. They don't need food now, they need acute inpatient medical care, and there are no inpatient beds for them to be admitted to and for them to be treated. I think this is the most important thing going on in the world at the moment. And whether we're individuals, societies, academic institutions, governments, or countries, we will all be defined by how we react to what's going on in Gaza. Everyone can do something. Look at you all here today. This is fantastic. We had a celebration, we had a vigil in Al-Aqsa Hospital one night. I've got a video of it, of everyone paying, in the patients, the orphans, the displaced people, paying tribute to the students around the world who are holding their vigils in camps and telling the older generations how they need to sort this problem out. These people who are living in tents, they're living in shelters, they were there paying tribute to all of you students who are standing up for what is right and to try and persuade our governments to do what is right. So carry on, and thank you very much indeed.